we have a group of individuals here, and we welcome you to Memphis. Appreciate your connecting with us here and spending time with us. And I know that they have a lot of questions, as everyone always does, about Medicare and how you, or Medicaid, what you end up doing with that. So we will go ahead without taking any more time to again welcome you, tell you how much we appreciate your doing this and helping us to understand and explain. And I will go ahead, Misty, and turn the program over to you and let you direct it.
Great. Thank you so much, Rita. I appreciate it. Sorry about all the technical difficulties. I am computer illiterate and just got Skype. I didn't realize you needed a computer, but it makes sense now. And I'm sure there are tons of questions. I'll just start out by one of the products that have benefit a lot of the clients here in Chattanooga, and then I'll just open it up for discussion. Can you guys hear me good?
Yeah, we're good.
Okay, you can? Okay. I can barely hear y'all. So if there are questions, I may need somebody closer to the mic to repeat them because I can hear you better now, yes.
Okay, well the mic was on the other side. Okay, we're good.
Okay, perfect. Okay. Now I can hear you, and I heard a little bit about what Teresa said. One of the products that has done so well for a lot of Chattanooga clients is the community plan that offers dental and glasses, a YMCA membership, and $115 every quarter to get aspirin, vitamins, Band-Aids, Neosporin, Proxide, at no cost if you have Medicare and Medicaid. Medicaid is also called TennCare. So if you have Medicare and TennCare, you qualify for that program at no cost and those extra benefits at no cost. Right now, United Healthcare is the only plan that's offering that at no cost to our clients. And you still, it doesn't affect if you're on any kind of choices plan or get in-home health care. And it doesn't affect if you get prescription drug coverage, because the co-pays on prescription drug coverages is determined by Medicare, not by the company that you choose. So it is an HMO plan where you want to make sure that your doctors are in the network before you change, which is what I do with anybody that's interested. The membership is full access to the YMCA to do aerobics, water aerobics, weights. The only time you would have to pay is if, you know, they're out offering a karate class and they charge for that karate class. But the membership is totally free, and they've now added the Rush membership also. So you can have a YMCA membership or a Rush membership at no cost. So that, and it's not based on age, it's not based on income, it's only based if you have Medicare and Medicaid, you're eligible for it. So if there are some that don't have Medicaid, there are other products available, they're just not free. So they, you know, several companies have plans that have zero premium, but then if you want to add dental or glasses to it, it's an extra premium anywhere from $26 to $36 a month if you don't have Medicaid. So that's what I wanted to explain, the options that are available and what has really helped in Chattanooga. And if it's okay, Teresa, I'm just going to go ahead and open it up for questions from that.
Just for clarification on the, you said the YMCA membership or the Rush membership, what were you referring to for Rush? I had a lot of quizzical faces on that one.
When you join the United Healthcare plan, we give a free membership to the YMCA or Rush. Now, it's called Silver Sneakers. I don't know if you're familiar with that. A lot of the plans have the Silver Sneakers benefit built into the plan. And in different places, it will tell you, like, since you guys are in Memphis, give me the zip code in Memphis.
38104 here.
Okay. I can go to silversneakers.com and put in, I'm just going to say a 10-mile radius. I could do more, but just to show you a 10-mile radius. And it shows that the Salvation Army has a workout facility. And let me see if I say this right. Fogelman Downtown YMCA is in network. Fitness Plus at Non-Cajon.
Non-Cana?
Davis, yeah,
Okay.
yes, thank you. Davis Family YMCA. Rick Newber YMCA. 24-Hour Fitness. The Works Health and Fitness in West Memphis. Snap Fitness in Bartlett, in Germantown Athletic Club, Cordova Family YMCA, and that's just in a 10-mile radius. So I can just go to silverseeker.com and see what's available in your area
Now,
on what facilities are free.
okay. Is that a walking club? Is that what that is? Since it's called Sneakers?
No, it's full access to the club. So you can work out, you can do water aerobics, you can do yoga. You know, you have full access like you went and bought the membership yourself. The only time you would have to pay if they are charging for extra classes, like they'll have karate class, or they'll have like a boot camp. They charge for those classes. So you would have to pay if you chose to take those classes. But if you just want to go to the pool or the hot tub or the water aerobic or the weight, that's all part of the membership. And so there's no charge for it for you.
Okay.
Is that silver
Does that help?
sneakers?
Yeah, and is there an age requirement for that? We've never heard of that one.
Yeah, there's no age requirement. You just have to have Medicare to be qualified for any of the programs that have the Silver Sneakers, or to get it free, you have to have Medicare and Medicaid. It's called Silver Sneakers, and Humana has it, Blue Cross has it, United Healthcare has it, HealthSpring has it. They all have membership, because they realize if we keep you healthy, we're going to keep the cost down of our health insurance, and we're going to keep you out of the hospital and the doctor, more also, by providing a membership. So it's cheaper to provide a membership to keep you healthy than it is to have to pay for, that health.
Yeah, got a question from the audience. She says,
Okay.
I don't know if I can get Medicaid. I do have Medicare, but I only have the Blue Cross. So to get in for aerobics, I can pay. I mean, I've been paying monthly for that for a workout place near my home. It's only about 5 miles away, but I do pay monthly.
Okay.
How do you get
What
the
is
free? How do you get the free?
She has Blue Cross what? Can you look at her card and tell me what kind of Blue Cross plan she has?
Well, it's in the purse. Says it's
I can
Medicare.
wait because there's several programs out there, so the card would help me. Because if she has Medicare, she could have a Blue Cross supplement, or she could have a Blue Cross retirement plan, or she could have a Blue Cross Medicare Advantage plan.
Okay. All right.
Do you need glasses?
Let me put on my glasses and I'll read the card.
Okay.
This one is Blue Cross Service Benefit Plan, federal employee. That may not be the one. And then Medicare
Yeah,
is
so
Part A
that-
and B.
Right.
Okay.
So she has the federal plan that does not offer the membership. Only Advantage plans and the supplement plans offer the benefit.
Okay. Got another question? Says I
Okay.
have HealthSpring. Now, yeah, Medicare also, so HealthSpring, and you talk, okay, and asking about the exercise program.
Okay,
Can I do
yes,
that?
it's included in the HealthSpring. They would take their HealthSpring card to the gym, and sometimes the programs will give you a silver sneaker card. But you could take the health card to the local YMCA and say, you know, my group said I would get a free membership, and if they want to write my number down, and I can walk the lady on the phone through it, but all the YMCA should be very familiar with silver sneakers. They just fill out an application like you were there to buy it yourself, and they bill it directly to the company.
Mm-hmm. So, it's just like, is Humana the same way?
Yes, absolutely.
Yes. In the back, yes.
I'm gonna ask you a question. What do you do if you don't have no Medicaid without anything?
If you
No
have no
insurance,
Medicare, no Medicaid,
No
none of that
insurance
stuff.
policy. No health insurance, anything.
Okay, what about that?
Okay. There is a law that December 26th through March, everybody has got to have some kind of health care coverage. Now, the state of Tennessee did not pass to put more people on Medicaid. So he's gonna have some kind of insurance policy, but what I would tell him to do is to try to apply for TennCare, just to see if they say no, and if they say no, I also do the policies under 65, individual health insurance. I could give them a quote on what the options would be. Now, the under 65 policies do not offer the free gym membership. They offer discounts, but they do not offer free. Only the Medicare programs right now are offering the free gym membership.
Okay.
Okay, clear? Okay, thank you.
You're welcome. Now, he's not been diagnosed as disabled, has he?
No.
No.
Okay. Okay. Because he should qualify for Medicare if so.
Okay. All right, another question here. Wondering, now, if I've been traveling and I happen to be in another place, you know, Kentucky, Virginia or something, you're talking about the insurance, will my insurance work there?
Okay, what insurance does he have? Do they have?
I have the Humana insurance,
Okay.
PPO.
The PPO, yes, it will work. You just want to make sure if where you are is in network or out of network, because out of network means it's going to cost you more. So you would call Humana's customer service and say, I'm going to Texas. This is where I'm going. Will I be in network or out of network? And all emergencies when you're traveling is a $65 copay, no matter which plan you choose. So you'll always have emergency coverage at $65, no matter which plan. But if you're hospitalized, like it becomes emergency, but then they keep you overnight, that's when you want to know if it's in network or out of network, because Humana's out of network is a deductible and a percentage. So you definitely want to make sure that if you're going to Texas, that you're in network. And maybe just get a list. Can you send me, they'll email you a list of what the doctors are. Or you can go to Humana.com and put in the state, and it'll tell you if they're in network or not. The good thing about Humana, and actually even now HealthSpring, Blue Cross, and United Healthcare, is they're in all 50 states. And Humana is Humana. HealthSpring will be HealthSpring Cigna. United will just be United. But Blue Cross is either Blue Cross Anthem, Blue Cross Shield. So they share a big network, and they have a couple different names. So either go to the website or call your customer service and say, I'm going to this city. Am I going to be in network or out of network?
I see a hand, yes. HealthSpring, yes. HealthSpring is also a $65 copay, as I recall.
Yes,
That was for the emergency room?
yes. That's correct. Now, HealthSpring is an HMO, so you definitely want to make sure you're in network with an HMO, because HealthSpring will not pay. They will pay an emergency, but if you get hospitalized, a lot of times it'll be out of network and they won't pay. So you just want to make sure that unless they have a $26 plan, it does have out of network benefits, and it actually includes the dental, and it's called a POS, which means point of service, which means it's like a PPO, where you can have out of network coverage.
Okay. All right, okay, you're next. United Health. I'm sorry, United Health and Medicare? United Health and Medicare,
Yes,
okay? What's the question? So, are you talking about in traveling? Yeah, again, the travel benefit, if there's any for that, for those two.
and is he talking about the Medicare only plan or the Medicare and TeamCare plan?
You have TennCare too? I have the red, white, blue Medicare, I have United and American Choice.
Okay, so AmeriChoice is TeamCare. So, he has Medicare and TennCare. So Medicare pays everywhere. There's no network. They just have to accept Medicare. So the 80% would be covered traveling, but the TennCare is usually just covered in the TennCare area. So he might have a little out of pocket because he has the TennCare, but AmeriChoice is owned by United Healthcare. And we have service everywhere, so he may be able to get the little copays covered. So if he ever has that problem, I did not give my phone number, but let me go ahead and give my phone number. If you ever have any general questions, you can text, you can email, you can call, and I'll get back with you within 24 hours of any questions. Now, I will say, October 15th to December 7th is Medicare's annual enrollment,
I'm
and
sorry,
sometimes it's a little bit longer when I get back to you, because I leave at 7 o'clock, and I usually don't get home till 9 or 10, 11 o'clock at night, until December 7th, just because so many people are trying to change their plan, plus I do seminars, plus I do health fairs, so that time of the year, I don't guarantee 24-hour callback, but usually texts are easier than voicemail, because I don't have to listen to it and then reply to it. So my phone number is 423, because I'm in Chattanooga, 240-0794. Was that too fast?
no, but I've got it written down, I'm just showing everybody, I'll go through it again. Yeah, same number.
Okay.
Have it home, okay, all right, and we have it here, okay. I think we're fine.
Okay, and now let me go into my email in case there are people that don't text, but rather email or whatever.
All right,
My email is Misty, Misty, Anderson, Anderson, all one word,
okay,
the number 1,
okay.
Misty Anderson 1 at hotmail.com. All that comes to my phone, and it's usually easier if I get a text or an email.
I'll need that again, one moment.
No, you go ahead and I'll put it up
Oh,
there.
yeah, oh, okay. Okay, sorry, just didn't have a pen that was working with me, but we'll get that up, we have that. Okay, we have the email.
Okay?
Okay, all right, hold, second. Okay, question for Bernard.
Thank you.
Okay.
I'm gonna ask you a question. I know we have this. Let me repeat one more time. You said if I had no insurance and claim anything, do I have to pay $65 myself?
If I don't have the insurance, do I pay a $65 copay? Okay.
Now, I didn't understand that. Repeat that again. If he goes where now?
If you go to where, or ask me again.
If I go anywhere to go,
If I
like
go,
the hearing aid, class,
if I go anywhere for like a hearing aid or glasses, even that?
Yeah. That's why
Yeah.
I want to know. If you include, I
What
pay
plan is he
$55
on?
a month worth.
Okay. I'm sorry, what, Misty?
What plan is he on?
What plan you have?
I had none. That's what I'm
There's
saying.
no
I
insurance.
had none.
Well, I have no
Okay.
insurance at this time.
Okay, there are no hearing aids for people, for individuals available, no hearing aid insurance available, unless you're on Medicare. There are programs like the Lions Club,
No
that,
insurance.
Kiwanis Club, that will help pay for those if you have no insurance or no income. Sometimes Salvation Army has money that will help. But Lions Club does glasses and usually hearing aids, and Kiwanis will help whatever needs available.
Interesting comment from here, got somebody saying, my Blue Cross will pay for a hearing aid. I just
Now,
bought one on
on the-
Wednesday.
is that the grid plan, the retirement grid plan?
Yes, it is a retirement Blue Cross, yes.
Okay, those plans are cut out by the employer, and they can add whatever they wanna add. But individual plans will pay for the test, but they don't have it where they will pay for the hearing aid.
I'm sorry, the insurance will pay for the test. Is that what you said? They will pay for the, the insurance will pay for the test, but not for the hearing aid?
I think we lost.
Are you there?
Oh, yeah, there you are, hi.
Hello?
Yeah, okay, all right, here's the, come back on that question. The insurance will pay for the test, but not for the hearing aid, is that correct?
It says you're still on here, but I can't hear anybody.
Can you hear me now? You
I
hear
can
me?
barely hear you.
Barely.
Yes, I can hear you now, good.
Okay, all right. The question was, well, it's a statement. Yeah,
Did you hear my answer on the hearing aid?
okay. I did not. It doesn't pay for the hearing aid, but it does pay for the doctor visit. Is that what you were saying?
Yes, that's what I'm saying. And she asked, will her employer plan pay for it? Well, the employer can pick their own plan to pay for that, but individual plans don't have that benefit available.
Okay.
$175 for the hearing aid and the exam.
Well, the hearing aid was supposed to be $2,000. They
Okay.
paid most of that, and what was left at $175 is what I paid.
That's very good. That's really
That's
good.
Very good, I know, that's pretty good. You need to join her family on that, yes. Oh, I'm sorry, yes, another question, yes.
Okay, how can you get Medicare and Medicaid?
How do you get that? Okay, how do you get Medicare and Medicaid? Let's start from the beginning. How do you get that?
Okay, Medicare is usually offered when you're 65, unless you have a disability. And if you have a disability, your doctor has to write the information that you're disabled, and you have to take it to the Social Security Board to get it. Now, Medicare wants you to be disabled for 2 years before you qualify for the Medicare. There are certain other circumstances where you don't have to be disabled for 2 years, like end-stage renal disease, which is kidney failure, or on kidney dialysis. So there's other ways you could have qualified without the 2 years. The only two ways are turning 65 and retiring, or being disabled. The Medicaid is based on income, and your income usually has to be $900 or less, $940 or less a month to get full TennCare, which pays the deductibles and the copays of Medicare. So you're covered at 100% if you have Medicare and TennCare. But also, and Teresa may know more about this than me. I know I could ask Lana. From experience, I was thinking that not having you know, the hearing or the seeing, that there was a case where you could get Medicare for what I have noticed, and, you know, working with them here at the center, they have gotten it because of that. Now, I haven't gotten it. Usually Lana handles all that for them. So I wouldn't be the expert on how to get that done. But I do know from being here that most of them have it because of that.
Okay, yeah, another question? Yeah, I've got somebody else. I am retired. I just retired this year. And I was wondering that my Medicare does not start until November the 1st. Now, if I go to a doctor for some kind of, say, therapy, will that be covered now?
Not with Medicare, no. His birthday is probably in November.
Yes, my birthday is November, she says, yes.
Okay, so your Medicare starts the first month of your birthday, which is nice because if it's the 15th or the 30th, you're kind of getting 30 days or 15 days free, but it starts the first month of your birthday. So if anything happens, if he doesn't have a policy through work right now till November 1st, he will have to pay for it out of his pocket.
Okay, I see. Another question. Oh, yes, I'm sorry. AARP. Seems they have insurance too.
Okay, yes, AARP and United Healthcare are, I don't want to say the same company, but United Healthcare underwrites all of AARP's business. So you'll notice when you start getting information, you'll see Medicare, AARP Medicare Complete by United Healthcare. Now, AmeriChoice, TennCare, AARP does not put their name on. But the Medicare Advantage plans and the Medicare Supplement are by AARP or United Healthcare. So you can get a supplement or an Advantage plan. And let me just real quick tell you the difference between an Advantage plan and a supplement plan. An Advantage plan, you no longer use your Medicare. You still have Medicare. You'll always have Medicare till the government takes it away from you. But these Medicare Advantage companies, AARP, United Healthcare, Blue Cross, HealthSpring, Humana, they contract with the federal government to provide the Medicare coverage, and they offer additional benefits that a Medicare does not offer. For instance, the gym membership. Some offer dental, some offer glasses, some offer hearing aids. But you never show your Medicare card. Your Medicare is now covered by that private company that you choose. Another good thing, it's not based on age. So, and Memphis does too. I'm trying to think because I have a few customers in Memphis. There are several zero copay, zero premium companies. So all you pay when you get on Medicare is $104.90. Now for 2014 that could go up. They haven't released that yet. But for 2013 right now, your Medicare premium is $104.90 a month. When you get on a Medicare Advantage plan, the Medicare sends those private companies that premium. So your Medicare is now being covered by whoever you choose. Like for instance someone said they were on United Healthcare, some said they were on Humana, and some said HealthSpring. They don't show their Medicare card when they're in this plan. They only show that private company card, and we offer those extra benefits. Now, a supplement plan, you show your Medicare card, and it actually supplements Medicare. So Medicare pays first, your supplement pays second, and there is a premium, and it's based on age, and it goes up every year. But the positive part of a supplement plan is there is no network. You can go anywhere that accepts Medicare. So you don't have to worry about it. Is my doctor in network? If I travel, am I going to be on a network? But the premiums every year, whether you use it or not, go up. And that's why the Advantage plans are so positive, because it offers it doesn't base it on age. The premium is the same and sometimes zero. So you don't have to worry about it going up every year and you're not using it. And prescriptions are included, and a supplement they're not. So if you get Medicare and you choose a supplement, then you have to buy a drug coverage. So the Medicare Advantage plans have all that in one, and there's no extra premium for it.
Okay,
Does that help?
understood. Now, AARP, they do have networking, right? Because it's, yeah, I mean, if I go over here, they say I can't go here, I gotta go over here. So AARP seems to have a limited network.
Now, is that the supplement or the Advantage plan?
The Advantage, yes.
Okay, the Advantage does have a network, but what they also have is like a PPO. So if you have the Advantage plan, you can still go out of network, but like family doctors are $10 more a visit. Specialists are $10 more a visit. Hospital, what is hospital? Hospital is, I think hospital is $75 more a visit if you go out of network. So it's just a little bit more to go out of network. There's not a deductible. There's just a bigger copay if you go out of network.
Understood. Yes.
If you have Medicare but you don't have supplemental insurance,
I lost you again.
what is the deductible and copay with no supplemental
Hello?
insurance?
Okay, yeah, how about it?
Okay,
Okay,
okay.
all right.
Did you hear that part about the United Healthcare?
Yes, we've got your
Okay.
answer. Okay, the next question, and I'm sorry, read that again.
If you have only Medicare with no supplemental insurance, what is the copay and deductible?
If you have Medicare but no supplemental, what is the deductible and copay for that?
If you have original Medicare, it's 80% coverage after your deductible of $162 for doctors, and then you have to pay 20% after each visit. That's $162 annually, and then 20% each visit after that. And hospitalization is $1,132 deductible, and then you're billed 20% after that for the doctors.
Thank you.
Thank you.
Absolutely.
Okay, question. Winder? No, I don't know. Windsor Insurance. You heard of that one?
Yes, I have.
Yes, that seems I have too. Okay, all right, the question then is, Windsor is an insurance, it is a health insurance, yes. Is that fairly inclusive, such as the United and Humanas and such?
Is that, I didn't hear that clear. I apologize.
That's okay. Is the Windsor insurance similar to these other plans we've been talking about all along?
Yeah, and Windsor is probably at the bottom of the totem pole on choices. They just have not developed their network very much, but they do. It's an HMO, so you can't go out of network. You don't have to have referrals. And it does have a plan that offers the, like, TenCare members. It just doesn't have as much benefit as the United Healthcare plan does. So some like it if their doctors are in it because they have a program that's like $98 a month. Well, I think it went up to $121 for 2013. It's $121 a month, and you don't have any copays except for like $10 doctor copay, and then your drug copay. So it's kind of in between an Advantage plan and a supplement plan, and it's not based on age, and you get those extra benefits. So if the network is good, if all your doctors are in it, then Windsor's a great choice. But there's just been a lot of network issues with them from just me being in the field.
Yeah, okay. Then I'm glad to have HealthSpring. Okay, next question. Yeah, Lisa? Okay. Yeah, the United. It is included with Medicare for things such as dental, eyes, and hearing aids. Is that what I'm understanding?
If it's just a Medicare only plan, for $36 a month, you get glasses, dental, and hearing aid coverage. But if you have to pay $36 a month to get the dental and the glasses, the hearing aid will come on the zero premium. But what United Healthcare did and what they're big on doing is buying small companies, like the dental. We bought a medical company. They bought a hearing aid company. And what it is, it's a mail order company. So you call this 800 number, they do a hearing test over the phone for you, and then they make the hearing aids based on your test. So they sell hearing aids for like $300 copay for each ear. If you buy the $36 premium rider, then you get it for like $180 per ear. So they're doing that more to offer the benefit that seniors want at a reasonable cost. So it cuts out the retail store and the retail prices and gives you nice hearing aids for really, really cheap. And we just started that. I think they started in 2013. They just bought that hearing aid company. And the clients that I have had use it have had success. Only one took it back because she liked the idea of being able to go into a retail store and get help and not do it over the phone. But they had talked about making a deal with these private companies and getting them to basically go in partnership with United Healthcare to say, you can see our members and we'll pay you this much, to have that kind of local, to be able to go in somewhere local.
Question? Yes.
So, for an individual who doesn't have the capability of taking the test on the phone, can they get them to would the insurance company allow them to go to a local business and do that testing? I mean, wherever, just because they are deaf or have a hearing loss and they can't access the phone for a hearing test?
They have partnerships, so I would just have to find out the stores in that area. That we don't have any in Chattanooga yet, but I can check to see if Memphis has any, what partnerships they have done within Memphis. But they're realizing that they're going to have to do something. Because if there's a hearing issue, how are you going to be able to hear on the phone?
Does seem a little
So they're
backwards,
working
doesn't it?
on that aspect.
Well, if you can't use the phone, you should be able to get the
But there are
hearing aid
several states that have
automatically.
already the retail stores in place, but Chattanooga does not, and I have not looked at Memphis, but I can check that out.
Yeah, I'd love
And find out, and they can also, if they're in it now, they can also call customer service, and customer service will tell them what what stores are in partnership with them.
Okay. Yes.
Let me ask you a question about
We're with Epic Hearing
I
now,
agree.
and there's several retail stores that use Epic Hearing.
Okay, I only heard part of that, sorry.
Okay.
Say again? That's not me, that's somebody else. Okay, yeah, what were you saying? Uh-oh, can you hear me?
Are you talking to me?
Yeah.
I was just saying about Epic. Epic Hearing is the hearing provider that we use. So there are a lot of retail stores that take Epic. So I would just have to find out.
Okay, Epic is EPIC?
Yes. And they have a website called epichearing.org.
Okay, epic.org. Okay. All right, one moment.
Danny,
Yeah, thank you. Okay. Okay, yeah, I got another question here.
Okay.
And it is a variety of insurances, but what about kidneys, surgeries, heart stuff, all that? Basically, everything is accepted in what? For insurance?
If you have a Medicare Advantage plan or a Medicare Supplement plan, they have to cover everything that Medicare covers. What is different is that you're getting more benefits on the Advantage plan than you are the Supplement plan. So,
I'm sorry.
all that stuff would be covered because Medicare covers kidneys, all of that medical stuff. And in the Medicare and You book that you get every year, they send you a new one on what the changes are. It will even say in there and talk about Medicare Advantage plans and the extra benefits that they provide. You just want to make sure that you check that your doctors take the plan. So anything medical necessary that Medicare approves, these companies have to approve it.
Yeah, well, Medicare is my long-time insurance company, so I want to be sure. Other questions? Oh, yes. Medicare, does it cover heart, kidney, and everything? What does Medicare not pay for? Let's make it easy.
Plastic surgery, they used to not pay for preventative stuff, but now they're covering physicals every year. So there's not much that they don't cover, but the biggest thing is like plastic and non-medical stuff like dental, hearing aids,
Okay,
glasses.
right, okay. But they definitely pay for, like, if you have a heart attack, everything along the way to get better, right?
Right.
Yeah. Uh-huh. All right. So if I want Blue Cross Advantage, I tell Blue Cross that I want Advantage or something? I mean, how do you
They can
find
call
that?
me. I'm a local agent. I'm not locally there, but I'm an agent in Chattanooga, and I can do like I'm doing now and go over what they're looking for, what their needs are, and help them find the best plan for them. And everything can be done over the phone.
Okay, now, so far I've been seeing let's say a counselor, and the counselor is trying to find someone, so I'm having to go to another state, actually in Alabama, and I know that Medicare would cover it, right? Somebody says you can't, though, do that with like, deaf services, but in Alabama, they have a lot of deaf that work through the mental health department. But then they say that they can't serve me because I'm an out-of-state resident. I live in Tennessee, and that's in Alabama, but that's where the service is.
Okay, what company are they with right now?
Medicare and Blue Cross, the federal employee version.
Okay,
I'm
and
also
again, I
retired.
don't really can't answer any questions about the federal program. But Medicare should cover it because Medicare, unless they don't take Medicare, but even if they don't take Medicare, they still have to take it, and they can only charge 15% over the Medicare allowable.
I guess I don't understand that. In other words, if I have Medicare, can I use that insurance out of state? You said Medicare would take care of federal stuff, I mean any state, but will Medicare take care of a mental health counseling session out of state?
Yes. Unless that client does not take Medicare, unless that not take Medicare. And if they don't take Medicare, you're still allowed to go, but they can charge you 15% over the Medicare allowable. So some doctors won't accept Medicare's payment because Medicare cuts everything in half. So if that mental health doctor, I would just tell them that you have Medicare and say, do you accept Medicare? And if they say yes, then they will bill Medicare first and then your federal plan second. Does that help?
And so that basically should work, right? Even if it's in
Right.
Alabama. Yes.
Right.
Then why do some people say that you can't?
I wouldn't listen to people. I would call the doctor directly. I mean, a lot of people say stuff they're not supposed to say. I would just call the mental health doctor directly and say, do you accept Medicare? Because I have Medicare and Blue Cross.
Other people say that. We don't know why they say that. They don't know. Okay? All right. Other?
Because they're not hearing that from the doctor, correct? They're hearing it from people, right?
Somebody deaf? No.
Okay.
But,
So I would definitely just call the doctor.
well, call the doctor. That's the answer. That's the answer. Call doctor. Okay. I'll do it. What else? You've got a very satisfied group so far. Any other questions? Oh, yeah. To apply for any of these things, again, call your number or send an email, is that right?
On the Medicare products, yes, and I can also help them get help with their prescriptions. I can try to help them get on TennCare. TennCare used to have an app on ten.gov, and they've taken that app off. I'm going to check it. I'm going to multitask real quick. They've taken it off where you can't apply anymore. You have to go to Human Services, but it says temporarily. So I don't know if they're waiting for the healthcare reform to kick on. Or if because they said they're not going to take any more TennCare applicants till they find out, but it's not allowing me to do it. I've done it for several people on the website to try to get them qualified for TennCare and Medicaid. So I can't help them with that, but they can go to the local DHS, Department of Human Service office, and apply with them.
Well, we're getting the frown because, we're getting the frown because DHS is a real unpopular place here.
Yes,
What
very
else?
unpopular. You spend all day.
Well,
Okay, I paid for doctor last $15. I have a problem.
I had to go to the doctor and pay $10. You don't have TennCare?
I won and it was red, white, blue, and salt.
Oh, yeah, you're right. Well, then you're gonna pay a copay. Yeah, Medicare. If you just have straight Medicare, nothing else, you may end up paying a copay for everything. Is that right?
Right, a copay and a deductible. And see, does she have a drug plan now?
You have a medical for medicine?
Yes, they cool.
Yes, through Humana. Through Humana.
Okay.
Through
And is
Humana.
she paying for that a month?
Yeah.
Yes, I am.
Okay, because there are plans, like Blue Cross, like United Healthcare, like HealthSpring, that offer zero premium and the drugs are included. Now, the copays are still going to be like $5 to $10 for doctors, 25 to 40 for specialists, but you don't have a monthly premium. So your drugs and all that are included, plus you get the silver sneakers, and plus you have an option if you do want to add dental, it's a $26 premium to add dental coverage.
Man, okay.
I have a problem. I keep going. Keep calling.
Keep calling, wait.
Now people try to fit out over. I wait. He supposed to give me two. I wait on that.
Who he? Who? I'm
They supposed to see me. I wait.
Who's they?
They see me to for here.
Oh, United?
Yeah.
Oh, okay. Waiting for more response from United. Is United known for being a slow responding company? For a doctor what? To find doctor tell you where?
Yeah.
Yeah, I
can.
can.
Try to get new insurance. Get you one.
primary, to assign a primary doctor.
Okay, now United Healthcare doesn't do that. Does she need one right now?
You need a doctor now? Soon?
Uh,
That's the question.
yeah.
That's the question. Yes? Yes.
Okay. Is she on the TennCare plan or is she on just a regular Medicare Complete plan?
Medicare. Red, white, blue, that's all?
That's all, why we prove that's all?
Just the Medicare.
Okay, with United Healthcare, correct?
I need to ask for everything, can
Well, I'd like to have the address and everything, but if she emails to you, can you help her with that one?
Yes, absolutely.
Use the email. She'll send it to you. Okay, okay. Yeah, I'm sorry. Let me go here. Okay, yes. All right. My husband, well, after his business had closed, there was no insurance there. He went ahead and retired, said that the other insurance like Cobra would be so expensive. So Medicare. I asked my doctor, could I put him on Medicare? The doctor said no. The doctor didn't really like Medicare, of course. So I've got him on my Blue Cross insurance. And now he's good with that. Not just my husband, but my doctor.
So what is the question?
Is that a question or just you commenting? Yeah, it was more of a statement. Thank you for listening.
Okay, okay.
Okay. Well, that's good. But that's true. No, that's smart. Yeah, doctors like to listen. Any more? If you have individual, you can always. Yes, I'm sorry, yes. Okay. Now, Misty, your email address, does this work, just in Tennessee, or can you get an email from anywhere?
Anywhere.
Understood, thank you.
You're welcome.
Yes. So far, back to the psychological appointments. That person there is a psychiatrist, but he can sign also. I don't know if the guy lives in Knoxville, but I just wonder, how do I communicate with him if I need some kind of counseling with him? If he lives in Tennessee, see, I used to could get an interpreter here to see a counselor, and it's more difficult, plus the expertise, they're not really here. So, yeah, if a doctor here doesn't know sign, they'll get an interpreter. I'm just learning that there is a doctor in Knoxville that can sign.
And they live in Memphis, right? The client talking lives in Memphis, but
That
the
is
only
correct.
doctor they know of sign is in.
That is correct. And the doctor understanding they live in Knoxville. So would going through something like Skype, is that something that can be done? One, would a doctor do that? And two, would that be covered with insurance?
If the doctor's in network, it's gonna be covered in insurance, but I don't know about, cause that's more of a doctor issue than a health insurance, cause the health insurance is gonna pay it if the doctor's in network, cause it's considered a visit. Whether it's, at home, on the phone, it's gonna be considered a visit. So, it's gonna be paid, but the interpretation part, I really don't know. I would think that would be, I know when I go in a home, whatever company I'm with will hire, like whatever company I'm representing will hire an interpreter. So, but I don't know about on a doctor's point of view. That's a very, very good question, but it would be to each doctor's discretion.
Understood. Okay, very important question here. Okay, now, still have to get the doctors to get interpreters. And, their big complaint is, I only get so much. Yeah, I mean, they got to have interpreters. They complain about the copay's not enough.
Well, and they shouldn't be complaining about that stuff with you. I mean, that's not your concern. Medicare does not pay at all. It's been a complaint for years. So, I mean, their only option is not to take it and charge 15% more. So that's stuff that you really can't help about, the copays. Now, they get a copay from you, but they also get a payment from the private insurance company. So they're getting paid twice, and we're getting them cash in their office daily, if that makes sense. But there's nothing I can do on what the copays are and what Medicare is going to pay and what these private companies are going to pay. Their only option is just to not accept Medicare and then just bill the 15% over. But it's definitely something that they shouldn't be discussing with you.
Right, right. Agreed. Lisa? Yeah, I want to know, I go to my doctor and then they want to send me, say, to the kidney doctor. But the kidney doctor won't provide an interpreter. What do we do?
I mean, the only thing we could ask which insurance company are they with?
The Medicare.
Only, just Medicare only?
Medicare? That's it? Yes, that's correct.
I mean, that, you could call Medicare and ask Medicare if they would provide an interpreter, but like here in Chattanooga, we have, the deaf services have interpreters that will go with them, but they will charge you. Do you not have that there in Memphis?
Yes, you have the interpreter office. Yeah, we've got the interpreter office, that's where we are now, but you know, the kidney doctor doesn't always call.
Yeah, but is there someone there that will go with her to the doctor to interpret, since you're at the...
Well, this is when my doctor refers me to a kidney doctor, and we go to, you know, make sure, but they refuse to hire an interpreter.
That's what I'm asking. So does the center there, can she hire somebody to take with her?
Well, if I can add in on that, what
Yeah.
I would ask you to do is to contact us, let us also call that doctor's office and advocate for you. We have been able to get some of the doctors to change and request interpreters. Some of them have stayed stubborn and still are not asking for an interpreter, but many of them have changed. It's improved over the past couple of years. It's better than it was before. So we'd be happy to try and work with you and help you on that. Sure. I have a question.
Another question? Yes.
Okay.
Could you go back again and talk about the
You go back and again,
insurance issue
talk about the
that's
insurance
coming up
issue.
this late fall, and just be sure
Here in
that
the late
everyone
fall.
understands about that with the requirement
The
for
insurance
everybody
issue
to
in the late
have
fall, I don't understand.
insurance.
The Obamacare, I said.
Yeah, the
Yeah, we're talking
Obamacare.
about Obamacare. How's that affecting everything that you
The only thing it's affecting right now is that everybody has got to have insurance by March of 2014. It's not changing Medicare at this time. And they're also adding, you have to cover pregnancies, it's no longer an option, and you have to cover mental health issues, it's not an option. So insurance is probably going to go up about 30% because of it's adding this other stuff to carry.
Right, well, that money's a driving force, isn't it?
Well, it's not supposed to be, but for the insurance company it is. It's supposed to get everybody covered that's been denied coverage before.
Yeah, what, 9 billion people in the world? What, you mean in the U.S.? 300
I have no
million.
idea.
300 million, not in the U.S. 300 million. Yeah, we passed that last, April. Yeah, that's 308. Yes. Well, all of us means that we have to have Obamacare by March of 2014.
You have to have some kind of insurance, not necessarily Obamacare, but you have to have some type of insurance. Or on your taxes, they will audit you and bill you for that amount. You'll be taxed on it. But Medicare is considered having insurance, so that doesn't affect anybody on Medicare.
Well, let me have a check here. Yes. So this starts in October, if I'm not wrong, goes to December, and then in January would be the new insurance. Is that all what you're understanding?
On
the timeline?
Medicare,
Medicare.
Medicare's annual enrollment to change your plan if you're not happy is October 15th to December 7th.
And Blue Cross would be the same?
If it's a Medicare plan, yes. Medicare's annual enrollment, all Medicare products are October 15th to December 7th.
Life insurance, is that the same? I mean, life insurance is like health insurance?
No, it's totally different. That has nothing to do with healthcare reform or anything.
Okay, good, thank you. Oh, Bernard,
Can I ask you a question? I know.
yes.
Ready?
Yeah, ready.
I'm ready. You hear me? I'm working.
Excuse me.
I don't have insurance.
I'm working and I don't have any insurance.
I don't have anything. What I do? I want to pay my own fine
I
to
would-
you. Anyway.
I'm working and I don't have any insurance. Would that be what?
Okay, you're working, have
Right.
no insurance, and you want to do what?
How you do that? That's me. I'm wondering how you do it. I'm not trying to pay insurance or how I
So-
do.
So you want to buy insurance?
Right.
Okay, how do I get health insurance? It's not like I can go to the store.
No, she can call me and I can email her a quote if she emails, or I can give it to her over the phone. She just
Right
email me
now.
her date of birth and her zip code.
Okay.
Okay. And tell her what's the zip code.
I will.
Okay, I will do that. Oh. And, the new insurance? What new insurance? Are you representing an insurance company as you speak to us now?
No, I'm representing all of them. The reason I talked about United Healthcare is because they offer the dental, the glasses at no charge, and most clients have Medicare and TennCare.
Well, I have called and asked, and they would not take my dental, my visual, nor my hearing aid claims, or desire to have that insurance.
What with her United Healthcare insurance, she's already called who?
Yeah, have United, American Choice, Medicare, and none of them provide the visual or the dental or the hearing aid.
That is correct. United Healthcare, Medicare, that she has Medicare and TennCare. AmeriChoice is TennCare. The plan I was talking about is a Medicare Advantage. So if she enrolled in a Medicare Advantage, it would take the place of Medicare. She would have United Healthcare for her Medicare and AmeriChoice for her TennCare. So she is not enrolled in the plan with the dental, the glasses, at all.
That's correct, I do not have that now.
Correct.
Right, so that's not an option.
It is an option for her. She has to enroll in the plan. We just need to make sure that her doctors take the United Healthcare TennCare plan.
Understood.
Other questions?
questions, anything? We may be rolling to a slow halt here. D-N? Got somebody spelling D-N, but I'll take care of him in a minute.
Okay,
Okay.
that's it? No more questions? Misty, would really like to tell you thank you so much for talking with us today. It's been very helpful, right?
Yes.
We'll do a yay for Misty. You gotta hold hands up.
You hear all that?
So, thank you so much. Really appreciate all you do and your work in helping everyone get their questions answered and try to work through this. It's always a puzzle for people. So, we will go ahead and disconnect. We'll tell you thank you again so much, and I will be talking to you next week.
Sounds great, Teresa. Thank you for the invite. And everybody have a blessed day.